Today topic is about palatine tonsil. Tonsil is a pair of lymphoid tissue that is located in palatine tonsil. As palatine tonsil is an location between a anterior pillar and posterior pillar which arises from the soft fellow. As it is present at since birth, it grew till 12 years and start to atrophy after puberty. As it develops from the second pharyngeal pouch. Epithelium is stratified squamous epithelium. As tonsils has following two borders, two surfaces and two poles. Two borders are anterior and posterior, two surfaces are medial and lateral, and two poles is superior and inferior. As we can see, we have taken the image that is sagittal section, as it is hard palate, soft palate, it is dorsum of tongue, anterior pillar, posterior pillar, it is a tonsil. As from this we can see, anterior border is related to anterior pillar, posterior is related to posterior pillar. Anterior pillar is formed by the palatoglossus muscle along which it arch, as well as posterior pillar is formed by the palatopharyngeal muscle, as superiorly related to soft palate, inferiorly related to dorsum of the tongue. As anterior border is palatoglossal muscle with arch, posterior is palatopharyngeal muscle with arch, upper is soft palate, lower is dorsum of the tongue. As anterior border is related to relation is with the palatoglossus muscle along with the arch, and posterior border is related to palatopharyngeal muscle which arch. Upper pole is a soft palate, lower pole is dorsum of tongue. These are all relations. Now let us know about the tonsillar bed, which is on the lateral surface of the tonsil. As first it is hemicapsule, which is formed by the pharyngobasilar fascia of pharynx. It is loose areolar tissue. This is external palatine vein, as this is buccopharyngeal fascia, maxillary artery. This is mandible. This is masseter. This is medial pterygoid, as this is submandibular gland. Upper one is palatoglossus. This is palatopharyngeal. As tonsillar blood includes following structures that are indicating hemicapsule. Next is loose areolar tissue which contain external palatine vein. Next we have buccopharyngeal fascia, submandibular gland, masseter, medial pterygoid, maxillary artery, mandible. and it also related to glossopharyngeal nerve as well as related to styloid. As the space between pharyngobasilar fascia as well and superior constrictor muscle, which is the superior constrictor muscle, is paratonsillar space which contain external palatine vein, which is the most common for hemorrhage in tonsillectomy. As medial surface, it is lined by the stratified squamous epithelium. It has 12 to 15 crypts. As it has also clefts. In this, the largest is intratonsillar cleft, which is also known as crypta magna, which developed from second pharyngeal arch. As let us see again what is tonsillar bed. It is nothing but the lateral relations of the lateral surface relation of tonsils are known as tonsillar bed. It includes hemicapsule, which is made up of pharyngobasilar fascia, loose areolar tissue, buccopharyngeal fascia, superior constrictor muscle, submandibular salivary gland, maxillary artery, medial pterygoid, masseter, mandible, as well as styloid is also related. As medial surface is lined by stratified squamous, 12 to 15 crypts, and has cleft in between two crypts. In that largest is intratonsillar cleft, which is also known as crypta magna, which developed from second pharyngeal pouch. Now let us know about the arterial supply of the tonsil. As arterial supply is mainly from the external carotid artery, which is a branch of common carotid artery. As now the main it is supplied by the facial artery. It gives two branches. One is tonsillar branch as well as palatine branch. Main is supplied by tonsillar branch. This is maxillary artery. It also supplies the tonsil. It gives the branch known as descending palatine artery. As ascending pharyngeal artery also supplies dorsum lingual artery. The arterial supply is mainly supplied by the facial artery, which gives two branches, tonsillar branch and palatine branch. Mainly it is supplied by tonsillar branch as well as supplied maxillary artery, which is also branch of external carotid. It gives branch to supply tonsil, that is descending palatine. Ascending pharyngeal also give branch, that is known as palatine branch of ascending pharyngeal artery. Lingual artery, which gives dorsal lingual artery, which also supplies the palatine tonsil. Venous drainage is mainly by external palatine artery, which is also known as paratonsillar artery. Dancer on palatine vein. It is also by facial vein. Lymphatic drainage by mainly jugulo-digastric lymph node, which is known as upper deep cervical lymph node. Nerve supplies glossopharyngeal nerve and lesser palatine nerve, which is a branch of trigeminal nerve. As I have taken one of the endoscopic picture to show the tonsil. As we can see, Tonsil is located in between the anterior pillar, posterior pillar, as it is a fossa that is present between anterior pillar and posterior pillar, as it is a oval mass, as well as it is one of the important structure in our body which is responsible for local immunity, as it is has upper related to soft palate, lower is related to dorsum of tongue, as it has medial surface as well as lateral surface. Now let's quickly revise about the tonsil. Tonsil is an lymphoid organ which has two surfaces, anti sorry medial surface and lateral surface. It has two borders, anterior and posterior, two poles, superior and inferior. As medial is lined by stratified squamous epithelia, lateral is relations are tonsillar bed that are discussed earlier in the video, anteriorly related to anterior pillar which is formed by palatoglossus, posterior is from posterior pillar which is formed by palatine pharynx, palatopharyngeal muscle, superior related to soft palate, inferior related to dorsum of tongue, as mainly arterial supply by mainly external carotid artery which gives branches are maxillary artery, facial artery, ascending pharyngeal artery, as well as lingual artery. Venous drainage is by external palatine vein, as lymphatic by jugulo-digastric lymph nodes, as nerve supply is mainly by ninth nerve, that is glossopharyngeal nerve. Thank you.